Today we're going to talk about preventive medicine. Preventive medicine is important as the goal of preventive medicine is to promote health and well-being and prevent disease, disability, and death. Leading causes of death in the U.S. are in order: heart diseases, cancers, unintentional injuries, and lower respiratory tract diseases. This graph shows the top 10 leading causes of death in the U.S. All of those causes are preventable. Disclaimer: screening and immunization recommendations may vary depending on the source. Specific disease states or conditions may warrant earlier or more frequent testing than discussed here today. We will first start with metabolic screening. Blood pressure screening. Adults with normal blood pressure should have an assessment of their blood pressure every year. Adults with risk factors such as obesity should be screened twice a year. Average normal blood pressure is 120 to 80. It needs to be treated if blood pressure is greater than 130 to 90 on 2 different days. Height and weight will be checked at annual wellness visit. According to height and weight, BMI, which is the body mass index, is calculated. Recommendations should be given regarding appropriate weight for height. This is an example of a BMI chart for adults. Cholesterol screening. Cholesterol screening starts at 35. Frequency of testing to be determined by provider based on risk factors. Normal cholesterol levels should be total cholesterol goal less than 200, triglycerides goal less than 150, HDL, which is the good cholesterol, greater than 50, LDL, which is the bad cholesterol, less than 130. For diabetic patients, LDL should be less than 100. For patients with history of stroke or heart attack, LDL should be less than 70. Glucose and diabetes screening. Elevated blood sugar is often asymptomatic. It is important to screen glucose level because at least 50% of diabetic will have a heart attack. It needs to be checked at least every 3 years starting in 40s. More frequent and earlier testing will be appropriate for those at higher risk, such as those with family history of diabetes, overweight status, history of gestational diabetes, or polycystic ovarian syndrome, or specific symptoms of diabetes. Thyroid dysfunction screening. Proper thyroid function is critical for most body systems. Malfunctioning thyroid may not initially cause symptoms. Based on overall health and risk factors, doctor can determine frequency of screening. The risk factors are female gender, advancing age, white race, type 1 diabetes, Down syndrome, family history of diabetes, prior history of goiter, hyperthyroidism, radiation to the head and neck area. Osteoporosis screening. In women, it generally starts at age 65 or at onset of menopause, whichever is first. In men, there is insufficient evidence on osteoporosis screening. DEXA scan measures calcium content of bones or lower spine, hip, and sometimes wrist. Higher calcium content usually means increased bone strength. Frequency of testing depends on results and other risk factors. The risk factors are age, lower body mass index, excessive alcohol consumption, smoking, long-term corticosteroid use, previous fracture, and fall history. Sexually transmitted disease testing. Annual chlamydia and gonorrhea test is recommended until age 25 if sexually active. It needs to be repeated if one has a new or multiple partners. Both partners should be tested for HIV, syphilis, and hepatitis. Hepatitis B virus infection screening is recommended in high-risk persons such as active injection drug users, men who have sex with men, and patients receiving hemodialysis. Hepatitis C virus infection screening is recommended in adults aged 18 to 79 years old. HIV infection screening is recommended in adults aged 15 to 65 years old. Now let's continue with cancer screening recommendations. Cervical cancer screening. Pelvic exams should be done every year beginning at age 21. For women aged 21 to 29 years, cervical cancer screening is done with cervical cytology every 3 years. For women aged 30 to 65 years, it is recommended to screen cervical cancer with cervical cytology alone every 3 years, or co-testing with high-risk human papillomavirus testing every 5 years. For women older than 65 years, cervical cancer screening is only recommended for patients at high risk of cervical cancer. This includes having a history of high-risk HPV positive, prior treatment for high-grade precancerous lesion or cervical cancer. Breast cancer screening. About 1 in 8 women have breast cancer in their lifetime. Breast cancer screening is done with a self-breast exam, clinical breast exam, and mammogram. Risk factors of breast cancer are mainly people who are older ages, have a family history of breast cancer, especially at earlier ages, who carry a BRCA genetic mutation, and have a personal history of chest radiation. Self-breast exam. Previous recommendation was a monthly self-exam after proper instruction. However, research no longer supports this recommendation, but be sure to share concerns with your doctor. Clinical breast exam. It should be done at least every 3 years between the ages of 20 and 30. It should be done annually after 40 years old. Annual breast manual exam by healthcare provider helps to find breast cancer earlier, as 10 to 15% of breast lumps are not visible on standard mammogram. Initial screening mammograms in women aged 35 to 39 years can be done in high-risk people. Screening mammograms in women aged 40 to 49 years with average risk factors should be individualized by shared decision-making based on risks, benefits, patient values, and preferences. Screening mammograms in women aged 50 to 69 years with average risk factors should be done every 1 to 2 years depending on the guidelines. Screening mammograms in women aged 75 and above is not recommended. Decisions to discontinue screening mammography should be based on a shared decision-making process informed by the woman's health status and longevity. Digital mammogram is better than traditional X-ray mammogram. We use digital mammograms. Breast MRI gives more details and can find subtle mass, especially in patients with dense breast tissue. Colorectal cancer screening. It is recommended to start screening at age of 50 and continue until age 75 years. In African American adults, colon cancer screening is recommended to start at age of 45, as there is a higher incidence of colorectal cancer among African Americans. Colonoscopy is recommended every 10 years for most patients at average risk for colorectal cancer who are willing to undergo this procedure. Fecal immunochemical testing, or GUAIAC-based fecal occult blood test, is recommended annually. Multi-target stool DNA testing, is also known as Cologuard, is recommended every 3 years. Sigmoidoscopy combined with annual FIT is recommended every 5 years. This is the schematic picture of colonoscopy. Any abnormal colon cancer screening test other than colonoscopy requires colonoscopy to detect polyps or mass. Prostate cancer screening. Screening for prostate cancer starts with annual prostate-specific antigen testing at the age of 50 years for average risk men as long as life expectancy is at least 10 more years, and age 40 to 45 years for high-risk men such as known BRCA gene mutation, African American, and family history of prostate cancer. Screening should discontinue at age of 70 or any time if life expectancy is less than 10 years. Digital rectal exam of the prostate gland is not recommended as a part of the prostate cancer screening. These are the sources used for preparation of this presentation. Thank you for listening.